Hello, my name is Aleksandr Dayanayev, and I'm the general dentist here at Steinway Family Dental Center. And we get a lot of questions about the root canals. So today we're going to answer some of those most common questions that you may have. The first question we have is, what is the root canal treatment? A root canal treatment is based on the anatomy of the tooth. The tooth has crown portion, something that you can see. If you open your mouth, you can look in the mirror and see it. It's the coronal portion of the tooth. And there's also a supporting part of it is the root, something that is sitting inside your gums, right? And inside the bone. Now, that root in the tooth is not a solid block of bone. You have a soft structure in the center of it that is basically occupied by the blood vessels and by the nerve tissue. The blood vessels give your tooth nutrition, so the tooth's getting food from your body through the blood. And the nerve structure is inside the tooth is reporting on it's like a sensory stuff. So it senses all the attacks that the tooth may get. Like, for example, if you bite into something hard, the nerve will let your body know that you're biting too hard and it would prevent you from breaking the tooth. The same thing if you're using something extra hot or extra cold, it will also let you know that the nerve is insulted inside the tooth. And the only way it knows how to let you know is by giving you pain. But you would know not to do that. The root canal therapy is when the nerve is getting sick or it's getting insulted by presence of bacteria or decay, and now it needs to be treated. Now, if we cut our skin, the skin will grow together. If we break our bone, the bone will grow together. But if we damage the nerve cannot regenerate itself. It cannot get fixed. Therefore, we need to remove the damaged nerve from the tooth. And the process of cleaning that nerve channel and removing the nerve from the tooth and putting an inert material to occupy the space that used to be occupied by the nerve, that is what's called the root canal therapy. The next question we have is, what are some signs that indicate that I would need a root canal? Well, number one, if you have pain, most likely you need a root canal. Number two, if the pain is waking you up at night, of course, it might be that you need a root canal. If you're sensitive to temperature, cold or hot, especially hot, and let's say if you drink something hot and you feel the tooth pulsating, then you need the root canal. There's also possibility that the tooth has a necrotic pulp, which means dead pulp, dead nerve. So the nerve is dead, you may get a cyst underneath the tooth because the body doesn't want any dead parts, so it wants to get rid of that bad tooth now, right? And you would need to get a root canal done on that tooth to trick the body into accepting that tooth back as normal. The next question we got is, can a root canal save a cracked tooth? And the answer is depending on the fracture. So if the fracture is horizontal and not vertical, which means the fracture does not go through the root completely, then the answer is yes, it is possible that the root canal may save your tooth. The next question we got, when it is too late for a root canal? It is too late for a root canal when the roots are fractured completely, or when the coronal portion is no longer visible and the entire root is underneath the gum line and you can see that you don't see the coronal portion anymore. Now, what happens during the root canal? During the root canal, the patient is getting numb, so they don't feel the dentist working and doing the root canal. Then the decayed part of the tooth is removed, and that will give us access straight into the nerve. And then we would get into the nerve and remove the damaged nerve tissue. Then we would clean the canal and seal it with the inert material that doesn't react to anything, and that will save the tooth. Well, that depends on the skills of the doctor and how many canals that we do. How many canals does that tooth have? Also on the cooperation of the patient. But it will take somewhere between 30 minutes to 2 hours. The next question we got is, will I need a dental crown after a root canal? And the answer is almost 100% of the time, yes. because the tooth is dead, right? Without the nerve inside the tooth, without the nourishment coming to the tooth is not as strong anymore because it does not receive any food from the body. So therefore, we would need some more protection or extra care for the tooth. Plus, if there is decay and a big chunk of tooth is missing, crown would be advisable so it can protect the tooth from further damage. The next question is, what type of anesthesia will be used during the root canal procedure? And it would be a local anesthetic that be used. So only that tooth, if it is on the top, or sometimes would be a block, but it's still on only that tooth and this side of the mouth would be now. Not the entire mouth, and you are not going to be put to sleep for that. There's no sedation. The next question we got is, how safe is a root canal? I would say it is very safe. There's very few complications from it and very rare. It works on about 99% of the time. The next question is, how do I prepare for root canal? Well, I would suggest that you get good protein breakfast in the morning, and then you would come in and just try to relax yourself. Don't get yourself nervous. The next question we got, how will I feel after the root canal? Well, you may be a little sore after the root canal, but you're totally not going to be incapacitated. You can be doing normal work that you usually do. The next question we have is, will my tooth be sensitive after a root canal? And the tooth might be a little sensitive to touch, but not to temperature. So it's not going to be as painful as it was before the root canal, pretty much right away. If you put a lot of pressure on it, that will still hurt. So try to chew on the other side. The next question is, what is the best way to recover after root canal? And the best way is to try to take it easy with chewing on this side. Chew on the opposite side. Take your antibiotic like the doctor will prescribe you. And the painkillers are optional. Only if you really need it, you can take the painkillers. For the most part, as far as I know, most of my patients don't take medication after the root canal treatment. So it is not really a painful procedure. It's not as scary as the patients say it is. And almost 100% of patients after the treatment, they'll say that they didn't expect it to be so easy. The next question is root canal treatment versus dental implants. What are the pros and cons for each? So the root canal is done on a tooth that needs a root canal, of course, but could be saved. The implant will replace the tooth that is missing. So that is the major difference. If you can still save the tooth, you will do a root canal. You cannot do an implant, right? But if you can't save it anymore, you can't do root canal, and you would do the implant. Both have its purpose. If you value your teeth and you're somebody who wants to preserve your teeth, then do the root canal and preserve your teeth from being extracted. But if it's too late and you do need to have the tooth removed, and now is the time for you to get an implant, then implant will replace the tooth. The next question is, why are dental crowns recommended after root canal? Well, for the most part, they recommend it because the tooth becomes brittle after the root canal is done. Like imagine a dead tree, right? The tree is dry and the leaves don't grow on it. So the tree and the branches are not moving with the wind as much. And that is why you see some of the dry branches, they fall off the tree, so they break off. So the same with the tooth. When the tooth does not receive any more nourishments from the body, because the channel that used to bring the nourishment is now occupied with something else. You had the root canal treatment. Now, the best way to protect the tooth is put the crown on it, so the tooth is not brittle and it's not fracturing on you. The next question is, how much does the root canal treatment cost? Well, it depends on the number of canals on the tooth, and also keep in mind, if you do need a root canal, you need more than just a root canal. You would require to get a crown on that tooth after that. And there is one more procedure that we haven't discussed yet that's called post and core. That is a gold screw, let's say, that goes into the largest canal of the canals that you have in that tooth. And then it helps you to retain the filling, and you can put crown over that. So there's more than one procedure. So I would recommend that you speak with the dentist to see how much is the procedure that you need will cost you. The most expensive root canal is the one that you don't need. Therefore, I suggest that you see your dentist and see if you really need it before you're actually so scared. If you don't have a dentist, you're welcome to come here and we will help you to find out whether you need the root canal or how much it would be before you would actually do the root canal if you need it. And those are the questions that we have about the root canals. Now, if you still have some more questions about that, or whether you yourself need a root canal done, you can contact us here at Steinway Family Dental Center, and you can call us at 718-728-3314, or you can go online, go to alldentalneeds.com and request your appointment to be scheduled online. And somebody will get back to you and you can come in and we can see and help you out with your root canal.